Hi, I'm Dr. Sebastian Gonzalez. The topic of this video is going to be tendon issues or tendonitis down the lower part of the hamstring. We've talked about before middle hamstring types of overuse injuries and high hamstring tendinopathies. Let's focus on the lower ones around the knees now. Treatment-wise on this type of condition, it's actually pretty productive to do a lot of work on your own. You might want to clear with your doctor first, but probably with this certain condition, you probably want to make sure that you're working basically myofascially down into the belly of the hamstring, because working on the belly really does affect the tendon in the long run. I wouldn't recommend you work on the tendon actually itself, because irritation to the tendon sleeve can really become a problem and you probably set yourself back. Now, the intent of this video is mainly to show you different anatomical structures in the area, figuring out what your basic anatomy is and if you have this problem at all in the first place. Now, palpation in the area behind the knee, the most important part is to really not only find bony landmarks, but for the most part just find out where the tendons are. So go ahead and push against me here. You're going to see these tendons pop up. The outside ones are actually fairly easy to find. This is the long head of the biceps femoris, and you're also going to feel the short head, but mainly the prominent one is going to be the long head of the biceps femoris, which is going to be the lateral hamstring. The medial hamstring, go ahead and push again. The first one, the easiest one to find is the semitendinosus, which is tendinous and really stringy at this point. Just deep to it, you're going to find probably on either side, if you push enough, is the semimembranosus, which is one of the medial hamstrings. It's just a different one. Innermore, you're going to get it's going to get a little more confusing because you're going to find some of the adductors. The gracilis, for example, is one that I typically find in here, that when people come in with this condition, they seem to say this is one of their issues with the gracilis tendon, but they think it's one of their hamstrings. So with that in mind, stretching and rehab at home would be more specific if you figure out exactly which tendon you're working with, so you can give them the right stretches for at home. Treatment on this, I like to basically find whatever region is the spot. Let's just say it's a semitendinosus here. So I'm going to get a contact point, shorten the muscle, and I'm going to lengthen it. And it's not going to be super comfortable, but at the same point, we're trying to drag the tissue past the contact point as we really put a firm pressure or tension on it. You don't want to compress everything down too much. There's actually there's some important structures right midline here that you don't want to compress. So this is actually an area I don't recommend people work on their own unless they're going to work on this region up here. The takeaway message on this distal hamstring tendonitis is basically you don't have to live with this tightness. It's not a normal feeling. It's not normal to have. And just doing a little bit of work proactively can actually save you a lot of grief down the road.
Don't forget to check out our ebook at the website below.